Hey guys, Dr. Bodle here, and you might be in the situation where your thyroid labs are normal, your doctor is telling you that you're fine, but you still feel like junk. Obviously, we have to figure something else out in these situations and uncover why you're continuing to have symptoms. For many people, this leads them down the path of doing a lot of reading and research, and eventually they come across the concept of optimal thyroid levels. We know that a large majority of our blood labs are based on averages. And if we're comparing our results to a generally sick population, then using the standard labs might not be a good way to determine whether we have good health or not. Now, while that approach makes a lot of sense, we also want to be careful of over reliance on some of these optimal ranges. So, in today's video, we're going to talk about the concept of optimal thyroid ranges and how it can be useful, while also covering some of the pros and cons. That way, we can be efficient with our assessment and our strategies. Quick note, this video is not going to be me giving you a bunch of numbers and ranges based on each thyroid marker. If that's something you're interested in, I have a video that talks a little bit more about that, or you can look those numbers up. Again, I want today to be more about your understanding of the overall concept, which I think will provide much more value to you in the long run. So, as we all know, in the thyroid and Hashimoto's world, one of the big problems that we have is you are experiencing something that is very real and impacting your life, but your doctor is typically dismissive of those symptoms and is unwilling to listen to you, even though you're telling them that you're continuing to have problems. This creates a disconnect where we start to question ourselves and our own experience. Am I crazy? Am I making this stuff up? Is it actually not real? Well, no, these symptoms are real, but because of the dynamic between you going in and seeing your doctor, who is supposedly an expert on the situation, and you just being a person who doesn't have any formal training when it comes to healthcare and thyroid function, it's only natural that you would start to have those doubts. This creates two problems for us. Number one, you're still struggling with a number of significant symptoms. And whether your doctor believes you or not, you still have to figure out where are these symptoms coming from and what can we do about them so you can start feeling better. And number two, because your doctor hasn't been receptive to you, it feels like we have to find some sort of shred of evidence. That way we can present it to them. That way they're finally convinced that, oh, you actually do have a problem going on. And therefore that can motivate them to help you take action. Because we're so desperate to find something or anything that will prove to our doctor and sometimes prove to ourselves that our experience is real, when we come across the concept of optimal thyroid levels, it feels like we've hit the jackpot and it makes a lot of sense. People say, aha, yes, my TSH is in the normal range, but it's suboptimal. And that must be the explanation for why I'm feeling the way that I am. To me, this makes a lot of sense. And I've said before that our health is typically not black or white. There are shifts and trends that can occur with our physiology that occur over long periods of time. Our body doesn't know what the ranges are, it's just trying to function to the best of its ability. And that's going to look a little bit different from person to person. I've even had conversations with medical doctors before and pointed out that lab ranges for TSH are going to vary depending on where you're in the country, where you are in the world, and what the averages look like in that particular location. Sometimes the top end of the range for TSH is 4.5 milliIUs per liter, and sometimes it's 5. So for a person whose lab result is 4.7, depending on where they get their testing done, sometimes they're going to be diagnosed with subclinical hypothyroidism, and sometimes they're not. Additionally, I've had these same sort of conversations with other practitioners regarding TSH and pregnancy. I like to point out that the optimal TSH for someone who's in their first trimester of pregnancy is less than 2.5 milliIUs per liter. One doctor said to me, yeah, but everyone isn't pregnant, and obviously we all know that. But my point was, someone's circumstances and physiology can change, and therefore the labs that we need to target can also change. And I don't think it's too crazy to then extend that thinking to someone who might be struggling with thyroid symptoms. Maybe their physiology has changed due to their health history, and therefore their target or their optimal for them might look different than the average person. Unfortunately, most doctors aren't too receptive to this way of thinking. And even though you and I know that health exists on a spectrum, the standard is still very rigid, even though there's evidence clinically and in the research that those ranges should fluctuate depending on the situation. So, how can we use optimal lab ranges to our advantage? Well, they can provide us with a structure where we can start to assess warning signs and also look at overall trends. So, although you want to use caution and certainly not use optimal ranges as a metric for diagnosis, if you start to overlay optimal ranges with your labs and you see a number of markers that don't line up, then that could be a sign that your health is shifting or that some of those trends might be tied into your symptoms. However, although we noted that optimal labs can be exciting because it gives us a new window into assessment, we also want to make sure that we're not reading too much into these optimal ranges and using them as the be all end all. As I just said, a lab marker falling outside of the optimal range cannot be used to diagnose a condition. Diagnoses require that we meet specific thresholds. And although it's certainly possible for our health to change and for us to become symptomatic before we meet that threshold, we can't definitively or technically say it until that box is checked. I've spoken before about how people with Hashimoto's can have low thyroid symptoms because they have positive antibodies, even before they notice an increase in TSH and a decrease in T4. However, we can't say that someone has hypothyroidism until that TSH is high and the T4 is low. Those are part of the diagnostic thresholds. So if you are using optimal lab ranges to look at and assess your health, they certainly can be helpful. But if you go into your doctor and you tell them that you have hypothyroidism because your TSH is trending high or is outside of the optimal range, they likely won't understand what you're saying and they probably won't agree with you. The other thing that we need to be careful about is putting too much emphasis on a single marker that is outside of the optimal range. The other thing that I mentioned before that you might have caught is we want to look at multiple markers that are outside of the optimal range to give us an idea of the trend of your health. While I do think we should take any marker outside of the standard range seriously, and this is another frustration that I have where many doctors will just ignore that and people don't know that they have markers that are outside of the standard range. But with optimal ranges, one marker outside of the reference is often less important to us and may or may not be tied into our symptoms. These values will fluctuate, and sometimes they show up outside of the optimal range. Now, you can certainly track that marker and see where it goes on subsequent labs, but we don't want to become overly obsessive about it, nor should we treat it as the absolute answer to our problems. I recently did a video where I talked about how endocrinologists sometimes aren't the best for thyroid care because they don't always look at the whole picture. They become so focused on their specialty and so focused on the specific thyroid labs that they run, they forget that our thyroid gland and our thyroid system interacts with the rest of the body. That can cause us a lot of changes in how we feel and function because our thyroid isn't as healthy as we'd like it to be. But it also means that other parts of the body can contribute to thyroid dysfunction. And if we don't fix those areas first, then it's possible we may never get our thyroid issues under control. Forgetting about this connection or failing to look at the full context of our problems can often lead to worse care for the patient and also prevent them from getting better. Unfortunately, sometimes this hyper focus on thyroid labs can also be exacerbated by the optimal ranges. And I've had patients come in before saying, look, my T3 is below the optimal range. I know that's the problem, and I know that's why I'm not getting better. And while I think we should certainly consider those as a possibility, sometimes when we look at that patient's history and check their other T3 results, we find that their T3 tends to be very stable, and there's only a few times when it's been below the optimal range. So as I keep saying, certainly don't be afraid to use these optimal ranges. Use them as a guide, as a framework, as a secondary check on the results that you already had done. Let them help you determine any trends that might be occurring with your health, and use them as an indicator for highlighting certain areas that require further inspection. But if only one or maybe two markers are outside of the optimal range and everything else looks reasonable, we likely want to broaden our perspective and look for other factors that might be contributing to our problems. Remember, your TSH, T4, and T3 might look normal. But if we run a more complete and expanded panel that includes thyroid antibodies and inflammatory markers, and all of these come back as positive, then the fact that our T3 may or may not be a little bit low when it comes to the optimal ranges probably isn't the main issue. Instead, due to the antibody activity and the associated inflammation, we now have an internal environment that, even though your T4 and T3 levels are fine, your body isn't going to be able to bind and utilize that hormone because the autoimmune process is essentially blocking it. So while I completely understand that some people have urgency with their health condition and we really need to dive into that nuance to figure out what's going on, if we do have the ability, we want to take our time, listen to the patient, get a good history, use optimal labs when appropriate, but then make sure we're running all of the necessary labs that are reflective of the symptoms that they're experiencing. So while optimal thyroid levels can be useful, they're just another tool in our tool belt, and we want to make sure we use them appropriately. By understanding their context and combining them with these other assessment strategies, we can use them to help guide our investigation while also avoiding some of the added stress that those normal fluctuations might cause someone if they don't understand things more fully. But I hope that this video has given you some better perspective on the subject, and you'll be able to go back, look at some old labs, and assess them a bit more effectively. If you do have any questions about optimal thyroid levels, feel free to leave me a comment down below, and be sure to let me know if this is a tool that you've used before and if it's something that's been helpful for you. If you like this video but you feel like you need more help, then I encourage you to reach out about my upcoming online 8-module course. In the course, I'll be helping women with Hashimoto's who aren't getting help with their doctor, want to make changes but don't know where to start, go from feeling tired, exhausted, and discouraged to making nutrition, lifestyle, and supplement choices with confidence. That way they can feel vibrant, strong, and love their lives again. If that sounds like that might be a good fit for you, then send an email to contact@seattlethyroidhelp.com with course in the subject line. If you're looking for other options to keep learning, make sure to check out some of the other videos here on my YouTube channel. Follow me on Instagram or Facebook for daily tips and strategies, or grab either one of my free downloads, which are linked in the description box. But that's it for this one. Thank you so much for watching, for commenting, and for sharing some of your stories with me. My goal has always been to provide more information and help you get better, and it really means a lot that some of you are taking action and seeing changes. If you liked the video, please remember to give it a thumbs up, and if you haven't done so, subscribe to the channel. It really supports me and helps us to promote this message of healing and wellness. But my name is Dr. Bodle. I hope that you have a great rest of your week, and I will see you in the next one.